But first, as well as nurses, doctors on the front line also are treating patients with COVID-19, and particularly those doctors who are working in emergency medicine. We've heard all about the problems from the lack of specialist protective equipment for NHS staff dealing with infected patients, but just how difficult is it? Let's talk to Dr. Katherine Henderson now, who's president of the Royal College of Emergency Medicine. Good morning to you.
Good morning, James.
What's life like then for the nation's doctors in A&E right now?
So it depends where you are. I work in central London and it is incredibly busy. So if you're in somewhere that is not quite got the patient load yet, it's probably quite quiet and you're doing an awful lot of preparation and training, which is excellent to have time to get that sort of thing sorted out. If you are somewhere that's getting a lot of patients, you're seeing a huge change in your patient mix. We're just getting a lot of coronavirus patients, and the other patients are not coming as much.
I was going to ask you about that because obviously with everybody sort of self-isolating and trying to find things to do at home to occupy themselves, a lot of people thinking of things like DIY and gardening. In that, in itself, I mean, that potentially could mean a trip to A&E if you come a cropper.
Yes, we would rather you decided not to, repaint your windows high up on a ladder or anything like that. So yes, if you could avoid that sort of injury, that would be great. But there is actually a bit of a serious message about this, which is we are slightly worried that some people who have got serious health problems are not coming, who perhaps should be. So we've seen a drop off in the number of patients presenting with heart attacks and strokes. It seems unlikely that those events have gone down. So we are worried that there are some people who are not coming who should, and that includes children, that children who seem to be fortunately less affected by coronavirus are maybe not being brought in or getting in touch with their GP when they actually have a serious illness, and should still please get in touch if you've got something that you're worried about.
What do you put that down to? A fear factor that people might catch COVID-19 when they come for help?
I think it's a combination. I think there's a genuine, really impressive, let's not bother the NHS if we don't need to. And also perhaps that feeling that maybe going into a doctor's surgery or going to hospital would be a bad thing to do because of the risks. And that's where, if we go back to the beginning of your story, talking about protective equipment, that was a bit of a worry. Now we've got the protective equipment getting out there and there's much more of it being worn. I think that we can say that the risk to the health service and the risk to patients is going to be reduced.
What about the issue of testing? We're falling well behind some other nations. How worried are you for those in emergency medicine about the issue of testing?
So it's a complicated issue, testing, and at the minute we're getting our patients tested. That's fine. That has been sorted all along the line. The issue about testing for staff has been that because of the quarantine rules, you can have somebody who's feeling absolutely fine needing to be off work because somebody in their household has got symptoms, and you don't know whether that person has actually got coronavirus or just got the common cold. So that has meant that there's been a lot of staff off, which has put strain on rotas, no question. Of course, it's perfectly possible that if when we get that index case tested, they're positive, and actually that quarantine has been absolutely the right thing to do. But we're going to be grateful when it's possible to do mass testing of staff to be able to see, are there some members of staff who can come off? I've got colleagues who are staying in the local hotel so that they can be separated from their household and then are able to come to work, or are doing their quarantine there in case so that they don't give it to anybody in their family. And that breaking the transmission is the most important thing. And that's why the stay home message is so vital.
Dr. Katherine Henderson, thank you very much for being with us this morning on BBC Radio Cornwall. She's president of the Royal College of Emergency Medicine.